Hello everyone, Ray Pedraza on the McAllen Cable Network with some special guests in our studio today. We have Miss Olga Gabriel and also Dean Craig Blakely, and they're with the Texas A&M Health Science Center and School of Rural Public Health, which is here in McAllen. Well, they have a campus here in McAllen on McColl and Vermont. Welcome to the both of you.
Thank you.
Very exciting school. For those people who aren't familiar with the campus, tell us a little bit about it really quick.
Well, the campus started in 2000. The program started in 2000, and we were not at that time in the building that we're in now. It was in a building off of 10th at the Carrier Plaza. And about 2004, the city and Texas A&M got together and built the building that Texas A&M is now in, and we've been there since 2004.
Nice. Well, we're certainly glad to have you in the neighborhood. We've been hearing a lot about you guys offering a Masters of Public Health program. Dean Blakely, tell us a little bit about that.
Well, we actually have two tracks operating here now. We've got a Master's in Public Health in Social and Behavioral Sciences, and we have another one in Border Health that is actually a unique program to our campus here. There's a couple of courses that are offered here that are shared up at our College Station campus, but that's a program that was developed to target the unique population health, public health issues in the border area. There are so many public health issues that are really influenced by the traffic across the border in ways that are very different than the rest of the state, rest of the non-border areas of the state. That we figured that would be an excellent program to develop that uniquely targeted this area of the state, the lower Rio Grande Valley in particular. And so the thing that's, I think, particularly unique about the way we package our programs here in McAllen, though, is paying attention to the population demographics. It was apparent to us that those who already have their bachelor's degrees and are looking for additional educational opportunities tend to be employed and not in position to travel to College Station to do a master's degree at our campus. Now, there are certainly some people that do that. But a lot of people are already committed to careers and families, and that's not an option. And so we looked at building a satellite program here that would allow for folks who are already in the workforce to gain access to master's level training in public health. And so the program that we, the delivery mechanism that we use here is actually one that presumes that people are working during the daytime. And so we, rather than having a typical class that meets 1 hour 3 times a week, we package that all into a 1 hour class that meets 1 evening a week. And we take what is normally a full-time student's 2-year program and we put it into a 3-year plan. So people take 2 courses a semester, fall and spring, and 1 in the summer. And then you can do the 45-hour master's program in 3 years, just part-time.
Very nice. It makes it easier to work around family and work.
Well, it adds a level of complexity for sure, right, because the volume of work is still there, but the structure is one that you can fit into your daily calendar.
Right. And what kind of careers can people find with a program, with the master's program?
Well, we find that there are a wide array of directions one can head. Nonprofit organizations, you see a lot of public health trained folks in nonprofits, and they can be educational kinds of programs, they can be health related programs, resources for the indigent kinds of programs. You'll often see people with master's trained degrees often in public health. Certainly there's the formal public health infrastructure, so you have a regional office in Harlingen and a county office here in Edinburgh. There's also educational opportunities, so you see a lot of master's trained people in educational environments. And a lot of people are entrepreneurial and sort of create their own nonprofit environment to have impact. But it's a wide array of things, and it can focus on issues such as environmental kinds of complications related to health, or behavioral patterns, or a lot of people end up in formal positions that are in the health delivery system, in hospitals or clinics, in management positions, things like that. So it's a wide array of opportunities.
Nice, nice. Now who can apply for the program? They don't necessarily have to be Aggies to go, right? From any accredited school, right? Mm-hmm. Talk to us about the application process and when people need to apply.
Well, we have 2 deadlines, and one's going on now for the fall. October and is one, and June 1st is the other. We have a summer program that's going to be starting. And they can call the campus and talk to Cindy. Cindy Beltran is our MPH program coordinator. But they're coming from all walks. I mean, we have, like Dr. Blakely said, the master's in social and behavioral health and the health policy and management. So we have physicians that are coming back into the program. So those are some of our students. Physicians who maybe one day want to get out of the clinic and maybe manage a hospital, run a hospital, a clinic themselves. We have students who are recently graduated, some from STC, UTPA, and A&M from our campuses in Kingsville, Laredo, and Corpus. So we have new students, we have older students, we have folks coming from the hospital's administration that maybe want to move up in those levels, so they're coming back to get their master's. And there's guidelines, you know, of a 3.0, have an undergrad, obviously. Their transcripts are set. We work on SOFAS, so they go through SOFAS and submit their transcript. Everything has to be done in a timely fashion, but we do have a person on staff that we're ready to help anybody who has any questions to do this.
SOFAS is an online application system that all of the accredited schools of public health participate in nationally. And one of the advantages of that is if you put in your electronic application through this system, you can very easily apply to several more schools across the country as well. Now that may be less relevant to the kind of student I was describing earlier who wants to stay in the community, but it's an online application system, basically.
You know, one of the things that people always consider when they're going back to school is finances. What would you say to somebody out there who says, gee, I don't know if I could afford that? What would you say?
I think it's very affordable. You know, I don't want to throw out a definite, you know, between 10 and 15,000. It's affordable. It's definitely affordable, and you know, you're doing it small increments at a time, so it's, you know, it can be done.
I think you're right there. I think it's about a $13,000 tuition and fees degree that you'd have to come up with over the course of 3 years, and I don't think there's any question that you can see the return on that investment in your career trajectory. But you know, that's a real amount of money that's $4,000 a year, basically, part-time degree.
Very good. Let's talk about some of the research that you guys are doing here in the community. Off air, we were talking about things with mosquitoes that you guys are doing with the city of McAllen and with the county. Talk to us about some of the other things, great projects that you guys are working on here in the community.
Well, we have full-time faculty on staff. So not only are the students getting, you know, one-on-one with faculty, like the dean said, it's distance ed as well. There's video conference. But those faculty that are here, when they're not teaching, are doing applied research in the community. So people may not hear about what they're doing, but some of the things that they do is, for instance, they'll work with the RT students from STC, the respiratory therapist students. And then those students go out into the communities, into the schools, and they'll work with asthmatic children. They'll work with the faculty there, the staff, coaches, nurses, parents, so that children who have asthma, you know, when they have triggers and they try to, you know, talk about the triggers and what is it that will start a child to have, you know, on an asthmatic route where you want to stop that, because of course it can be life-threatening. It's also serious, but it's also very scary. So they talk to the kids, they train them how to use their peak flow meters, and this is an ongoing, not so much research as it is training. There's research and applied research in diabetes and infrastructure. We have faculty that are working with school districts, community centers, where they're trying to, and cities, and at the county level as well, where they're trying to improve infrastructure. We're targeting obesity and diabetes. You know, how do we get families out to walk more, children to walk more? But they need to have proper infrastructure. Is there lighting? Are there walking trails? And so some of the grants that they've been able to secure actually go back into those communities to improve walking trails. They may have helped the city put up lighting or build a track. So these are some of the areas to get families out walking and more, do more exercise.
And you know what, we're seeing that right here in the city of McAllen. People are demanding more walking trails, or they're asking for bike lanes, and people are wanting to, like you said, they're wanting to get fit because they're more educated and more concerned about their health.
Their health.
I'll add you a number to that one for you. About a year and a half ago, the state demographer put out figures that suggested that if we don't do anything to impact the trend that exists in obesity, that by the year 2040, over half of, approaching 70% of the adult Texans will be obese. Now, if you think about the implications of that, it's just incredible. Not only does that pose a whole array of health-related problems getting much worse, but it also suggests that our workforce is going to be compromised substantially as well. So we have to do those kinds of things. So it's always good news to hear that there are communities that are stepping up and creating environments in which people can move around more. I mean, one of the things about truly urban areas where there's mass transit, you see people walking a lot more because mass transit doesn't take you exactly to where you need to be. So there's walks on both ends. In smaller communities, everybody's in their cars all the time, and there's just not much walking going on. And so anything we can do to create change there is really important. Then I'll mention a second thing that's sort of on the horizon. We've done a lot of work here in the community in the colonias, working with promotores on all kinds of health-related projects. And that's a segment of the health delivery workforce that's been utilized a lot, but not formally integrated into the payable health delivery system. And so it's sort of an add-on that's working with grant funds and not part of the health delivery system directly. I think the 1115A Medicaid waiver activity that's going on now, that we can talk some about if you like, is going to provide an opportunity for some substantial changes in health delivery systems in Texas over the next 4 years.
Well, let's get into that. How is it going to affect?
Well, basically the 1115A waiver, Medicaid is a federal-state partnership. And there's changes by state, but the proportion of funds that come from the feds versus the state based on demographics of each state. The state has just had in this past 6 months a 5-year waiver approved by the Center for Medicaid and Medicare Services centrally, or in Baltimore actually, that will allow us to alter some of the ways that we implement the Medicaid program in the state. And it's going to allow, a big chunk of the funds go for uncompensated care in hospitals. That's a huge cost that we bear across this country. Texas, of course, one of the worst states with 26% of the kids, for example, having no medical home, no access to health insurance. And so heading toward the Affordable Care Act in a couple of years, depending upon what happens with court cases that are being heard nationally, of course, the waiver provides us an opportunity to take a step in the direction of expanding access to care through Medicaid in ways that are hopefully designed to reduce that huge flow of uncompensated care that occurs in hospitals. Much of it has to do with folks who don't have insurance, folks who have problems that could have been prevented and dealt with at a much less costly level had they been addressed much sooner, people who have complications in terms of the degree to which they have formal access to any health delivery system in the states. So there's a lot of segments of the population that have very restricted access to our health delivery system, and it leads to preventable problems getting worse and costing more to deal with later. And so one of the things that this new system is going to do, first of all, it's going to allow us to bring a bigger match back from the federal resource pool into the state. This is a $29 billion proposition over the course of the next 5 years, which is about 2.6 times the resources that are in the system right now. And so there's going to be opportunities to invest in segments of the health delivery system that are designed to try and provide or supplement post-hospitalization services in ways that improve the probability of rehospitalizations occurring at a lower rate, and that will also try and provide services that will lead to prevention of new hospitalizations, particularly in that segment of the population that's uncompensated care. And so it's going to also bring together the hospitals and the FQHCs, the federally qualified health centers, other clinics, the county, because the county is going to be the counties are going to be players in managing the resource flow. And so there's a multi-county region in South Texas that's going to be developing right now in the next couple of months the plan for this segment of the state that will target how those services will be altered over the course of the next 4 years. And we'll probably be engaged in some of the activities that are related to working with promotores as lay health workers to try and improve adherence to treatment protocols that are out there, and to try and identify preventable sorts of activities and get people into care sooner, and increase the access to medical homes through all sorts of creative ways with a wider array of players at the table. So it's an interesting opportunity.
Very nice. Olga, you guys have done a lot to create awareness about yourselves and the community, and one such way is a new water tower that's gone up in South McAllen. Let's talk about that a little bit.
Yeah, we're very excited. It's wonderful. It's on the corner of McColl, Vermont, right behind STC, and it's pretty big. Can't miss it. Yeah, so we have one side, and it's facing, our side's facing west, so eastbound traffic will see it, and it's beautiful.
Very good.
You know, Olga joined our team a couple of years ago as the director of the center, and one of the first things she did was advocate for one of those brown signs out by the freeway. One of the things that's great about good collaborative partnerships is there's opportunities for things to move to the next level. The city's clearly trumped her efforts to put that brown sign out by the freeway.
That's good to have signage up.
Right, right. Okay, very good. If people would like more information about what we talked about today, about your Masters of Public Health program, where can they go to find more information?
Well, again, we're on the corner of McAllen, Vermont, just a block south of Ridge Road. They can call our office, 668-6300, and we'll direct them from there. We also welcome people. 8:30 to 5:30, we're there, we're open. We'd love for them to come in. We'll give them a tour, talk to them about the courses. Faculty are there. They're welcome to talk to the faculty, give them as much information that we can help them with to make that decision if they'd like to continue working on their Masters of Public Health.
Very good. Dean Blakely, Mrs. Gabriel, thank you so much. Any parting words?
Oh, I think there's a lot more on the horizon too, so
Yes.
stay tuned, pay attention. We've got new programs we're working on that I think are going to be important, and we look forward to growing as the city grows.
Well, we'll be happy to have you guys back to talk about it.
Great.
Sounds great.
Thank
Very good.
you.
Good luck in the SEC, Gabriel Aggies.
All right.
All right, Dean Blakely, Ms. Gabriel, thank you so much.
Thank you.
We appreciate it. We, of course, thank you for watching. I'm Ray Pedraza, and this is the McAllen Cable Network.